All right. So, hi, my name is Dennis Polygenis. First of all, I'd like to thank Nathan for a great presentation, a very comprehensive presentation. As a functional evaluator, I know how crucial it is to get um, the right information and getting a comprehensive PDD to be able to do my job. So, I definitely appreciate the work that goes into a proper PDD, so we can then go ahead and do our job. I'm based out of Toronto, and we're having the similar weather whiplash that Nathan is experiencing. And I'd like to thank everybody across the globe who has logged in to our presentation. Through my work with CARF, I've had an opportunity to visit many of the countries represented here today, and I could definitely appreciate some of the differences globally with some of these assessments. And I'll try to do the best I can to help you all navigate these type of assessments and the reports when you're reviewing them. So I'll shut the camera off for streaming purposes. All right. So as you can see from my first slide, I have a gavel and scales. That's because, in North America, FAEs are commonly used in legal proceedings, whether it be arbitrations or trials, by judges and legal representatives who, really have to make a decision of determining whether somebody is able to return to work, somebody presents with a disability, and they become quite comprehensive, and they're looking for objective quantification of somebody's abilities versus a form saying this person can or cannot do a specific activity. FAEs across the globe range from a one-page summary to 50 pages like they are here in Canada. So there's a lot of variations of what people define as FAEs. I'm hoping here to go through what comprehensive FAE that we commonly do here, but you'll recognize a lot of components that are very similar in the FAEs that you've seen. And sometimes it could get quite overwhelming when you're seeing charts and figures and numbers in some of these reports. So hopefully after today's presentation, you'd be more comfortable identifying some of the key aspects of these reports and be able to navigate them and assist in return to work or assisting patients get through their disability. All right, so first let's define some terms. So common terms that we use are impairment, disability, and handicapped. So firstly, an impairment is a loss of abnormality of physiological, psychological, anatomical structure or function. So in our context, an example would be an impairment would be a torn rotator cuff in the shoulder. A disability is a restriction that comes out of that impairment. So for example, if a torn rotator cuff, you're limited in your ability to extend your arm above your shoulder. So that would be the disability associated with that impairment. Now, a handicap is how the impairment disability affect your activities of daily living. So a handicap in this example would be being unable to take a shower, wash your hair, scrub your back. So that would be a handicap in terms of your personal care functions. So in our context here, oftentimes we're looking at whether there's a disability that a patient has that prevents him or her from either returning to work or returning to any form of activity of daily living. So what's the purpose of an FAE? So basically, the purpose of an FAE is to collect reliable and objective information in order to predict and estimate a patient's potential vocational status. So normally here, there are 3 to 4 hours. So we're taking those 3 to 4 hours of performance and trying to extrapolate it to a normal 8-hour workday. The protocols that we use in FAEs are extensively reviewed through the literature. They're comprehensive. They're looking at various facets of someone's functional abilities, and it's comprised of various components. And each component is independently verified through the literature. So, I'll talk more about the softwares that run these protocols, but you'll notice that every component you see in an FAE is similar across countries or across other formats. So things like gripping, lifting, and a lot of the frequency demands. And as I mentioned, usually it takes about 4 hours, dependent on, the person's ability, sometimes less if they're not able to do much. And basically, we're trying to determine their functional ability over the course of a workday. Here in North America, there's there's several systems that incorporate the various testing protocols into one platform, computer software. I personally use the Archon and Matheson, but there's Workwell, there's BTE, there's Metrics. You don't have to use these formats to conduct an FAE. The advantage of these formats is that they integrate all the testing protocols, and they calculate coefficients of variation, industrial standard percentages. So they're really handy at doing a lot of the calculations and providing data that is both objective and reliable. So when you look at these reports, and Nathan touched upon it, you're going to see various terms across a lot of these reports. You're going to see things like occasional, frequent, and constant. So to quickly define, I know Nathan went through it. Occasional is performing a task within 33% of the workday. Frequent is 34 to 66% of the workday, and constant is 67 to 100. You're also going to see strength demands: sedentary, light, medium, heavy, very heavy. So these are pretty standard. Like Nathan suggested, sometimes the occasional, frequent, constant, they'll use never and other terms. But typically, these are sort of the terms that are standard when conducting these FAEs. And when, really the whole crux of it is the lifting demands and how often throughout the workday can a worker perform the specific lifting demand. So effort, validity, and reliability. So really, this is, the crux of the of an FAE, of a well done FAE. Basically, we're not only looking at the patient's ability to perform tasks, but we're also looking at reliability. So we look at various things. We test every test that they do, we time them, and we time them 3 times. And what we do is across those 3 times, we're looking for variability. So if I would ask somebody to do a reaching activity 3 times and time them, typically you would expect that the timed performance is very similar within 10% of each other. But if we get performance that say 10 seconds on the first trial, 20 seconds on the second trial, and then 15 seconds on the third trial, there's a variation of the coefficient of their ability. So anything over 10% variation is determined that is not necessarily a reliable performance. So what we're looking for is consistent performance through 3 trials. You may have difficulty doing the 3 trials, being slower, but that doesn't mean it's unreliable, because you're typically going to have that same performance across the 3 trials. Other things we look at is we measure heart rate. So performance, if somebody's putting in a lot of performance, we're going to see variations in their heart rate. If it's a static heart rate, we conclude that they weren't really putting a lot of performance. We're looking at things like sweating, redness, facial, grimacing, to try to identify effort. We're looking at the way their muscles contract. And we also look at things like, sitting tolerances, informal observations. If they're sitting in the waiting room filling out forms for 30 minutes, but yet they come in the room and after 5 minutes, they say they can't sit any longer. So we're sort of comparing formal and informal observations. So we're really looking at the whole scenario of how they perform during that assessment. So even if a patient declines most of the tests, if the validity checks are not passed, the report is still valuable, because basically suggesting that he or she may be able to do more than what their performance was during that test. So we're not only looking for how they perform physically, but we're also looking at the willingness for them to perform tests. So, if somebody does not put in a lot of effort during an FAE, you can conclude from that is that there's a decreased willingness for them to try to return to work, or wanting to return to work. So people who have very high validity in their assessments, typically are individuals who, really want to get back to work despite their limitations, even though they don't perform very well and aren't able to meet their demands. But if there's a willingness to try everything and to perform these tests, it's still a valid, assessment. So, that's something that you should be looking at in terms of these reports, not necessarily what they're able to do physically, but what their effort was during that assessment. So what are the components of an FAE? So we usually take a patient history and job information. Now, if we have someone like Nathan giving us a great PDD, then that job is easier. Oftentimes, though, we don't have the luxury of having a PDD. So we have to gather that information from the patient. We also have to rely on industrial standards. The US uses the DOT, the Dictionary of Occupational Titles. Canada uses the NOC, which is the National Occupation Classifications. And these are databases, public databases that have sort of very basic information of lifting demands and frequency demands of occupations. So, we would have to take a detailed history of the job from the patient and then have to match that to some of the industrial standards if a PDA is not available. And also, as physiotherapists, kinesiologists, we have a background in assessing jobs. So, we also use our personal experience, and we know that certain jobs, what the classifications are for standard jobs versus others. So, in the absence of a PDD, and, a lot of employers don't have it, although now it's a lot better in North America, in Canada at least. But oftentimes you don't have the luxury of a PDD, so we would have to gather various information from various avenues to be able to do a proper job matching. We do an MSK assessment using the goniometer and inclinometer. A goniometer is what Nathan showed you earlier for range of motion. And then we do all the functional testing. So I'll take you through that for those of you who have not seen some of the steps of an FAE or the testing. So the grip test is measures two things. First of all, it's obvious we're measuring the grip strength of an individual through various positions. So very wide position and very narrow positions in order to determine their abilities to grasp objects of various sizes. But grip strength is also an indicator of effort, because what we do is we compare their performance on the grip strength with what normal standards are for an individual of their age and their sex. So if somebody is coming in with a knee problem and their grip strength is at 50% of what is expected, we're taking that and we're suggesting that perhaps they're not putting in a lot of effort, because there's really nothing physically wrong with their upper extremity for them to be able to score that below the industrial standard. So we're looking at those validity as well as their physical ability to grip. We're looking at dexterity. So there's a pin board there that you see. So we're checking each hand individually and both hands together. So we're having them move pins from one hole to the other. We do this 3 times on the one side, we do it 3 times on the left side, and then we do it 3 times bilateral, so both hands together. And again, we're timing each trial, each set of 3, and then we're measuring the coefficient of variation of the left hand, right hand, and both hands in order to determine validity. And then it's more sort of gross handling, so handling of larger objects. Again, this is something you would see in assemblers, line workers, people who would have to, use screws, tools, widgets in general, anything that requires opposition of the fingers. So again, we're testing this on the left hand, the right hand, and then both hands together. And then we're doing reaching. So we're looking at reaching at shoulder level, reaching above shoulder level. We're looking at bending. We're looking at squatting. We're looking at kneeling. And then we're looking at ladder mobility. So if you notice, a lot of these components were identified, are looked at in Nathan's PDDs. So a lot of these terms are included in the PDD. So what we're doing is we're taking those definitions or those performances on what's required in a PDD, and we're testing them in the FAE to see if the requirement of the job is matching their performance. And again, everything is repeated 3 times, and we're measuring coefficients of variation. Ladder mobility is also something that we test. Oftentimes people have to climb ladders. So we not only do we do stairs, but we also time people going up and down ladders in order to determine their ability. So we do look at the job before we start the assessment. We may have to add specific tests for people who have unique jobs, you know, things like crawling. So people have to maybe crawl through ducts. So there's also tests for, you know, timing somebody crawl a certain distance. So, you know, although these are the standard tests, we also add on tests based on unique demands of the job. Again, which is why a comprehensive PDD is so important when we're doing these assessments. So lift capacity. So that's a picture of a lifting station. So what we're doing is we're measuring a patient's ability to lift at various levels. So the first thing we look at is we're looking at their ability to lift from waist level to the floor. So from the middle platform to the floor. And we're also looking at their abilities to lift from the middle platform to the top platform. So what we do is we test their abilities to do it one time. So what we do is we start with 0 weight, then we do 10 pounds, then we do, so 0 weight would be basically an empty box, which is 2 pounds. Then we would do 10 pounds, then we would increase to 20 pounds, and then keep on increasing intervals at 10 in most cases. So what we do is we test their ability to do it once, which is like the occasional level, and then we test their ability to do it frequently, 4 times continuously, and look at their abilities. And we also test their carrying. So we take that crate and we have them walk 12 feet distance 3 times, and then time them doing that carrying. So as they're doing that, we also take into consideration their perceived exertion. So we have a scale of 1 to 9, and we ask them what they rate the ability, 1 being light as a feather, 9 being too difficult to lift. So as they're doing that, we're monitoring their heart rate, we're monitoring their exertion, and then we're also looking at their perceived exertion. And that's how we were able to determine what their abilities are. So if somebody, you know, has fluid movements, is lifting it up and down, no problems, then that's great. But then oftentimes people are lifted, or, you know, they'll remove one hand and they'll finish it with the left hand, they'll grimace, they'll slouch, they'll have pain. I mean, in that case, we don't count that as being able to do that. What we're looking at is a fluid movement with you know, a low perceived pain and exertion, and that's how we determine what their lifting abilities are. And again, we're also taking into consideration their heart rate. We're looking for a heart rate that increases as we continue to do these tests. Anything that has like a static heart rate or an increase of 1 beat per minute is something that we would determine would be relatively low effort. And obviously if the heart rate goes down because they're not putting any effort at all. So that's how we test the lifting capacity. We also have, we measure push-pull. So we have static push gauges. So we measure both. And then, like I mentioned previously, we do carrying, which is carrying a crate of that load back and forth 12 feet, and we time them. So what are the elements of an FAE report? So things that you should see in a proper FAE report are job match tables, and I'll show them. So that's basically matching what the requirement of the job is versus their performance. And if there's a discrepancy or in their performance, so basically where they matched or they weren't able to match that job demand. You should be looking for physical effort and validity findings, so coefficients of variations, some objective data with respect to their abilities. You should look for an overall strength demand rating, so whether it's sedentary, medium, or heavy. And then you're also looking at overall conclusions and recommendations. So basically the picture of this individual, how they performed, what their abilities are, and what you think, what your conclusions are in terms of their vocational abilities. And then there's an appendix that has all the FAE data, which is something that's generated by the software. So this is a job match table that is generated by the Archon system, but it's something that I use. So as you'll see, so there's two sections. So there's the load demand, so the strength demand section. So it's the loads, so the lifting. And then here are the frequency demands. So basically the time tests. So you're looking at, so these are what we tested: low lift, mid lift, carry, push, pull. So this is their performance. So I think in this case, I used Mr. DeGrasse as an example. He's the recycle worker. So his performance in lifting was light, up to 20 pounds. His carrying was medium, and his pushing pulling was medium. Here are the job demands. So I took the job demands that Nathan provided, and this is what was in this column here is all the information provided from the PDA. So his job demand was medium. I believe it was up to 50 pounds that was required. So obviously there's a deficit there. Carrying, he was able to carry within that range. So I should say a footnote here. If the job demand says 50, but the person demonstrates the ability to, during the FAE to carry, say, 40, that's still within the medium strength demand. So if they fall within that strength demand category, we take that into consideration. So although in this case, I believe, he lifted 40 and not 50, he still meets the job demand. There might be a mild, a mild deficiency, but, we also take into consideration that he's not always having to lift 50 pounds every single day. That's the maximum amount required to lift. So if they perform within that job definition, then we conclude that there's a deficit, unless, the job demand is 50 and he lifts 21 pounds. So although that's within the medium, then there's obviously a deficit there. And he was able, and here it was pushing with pulling, he was able to demonstrate, he was not able to demonstrate that job demand because obviously they're pushing and pulling heavy recycle bins, and that was over 50 pounds, and he did not meet that job demand. Here is the frequency. So, these are the performances. This is the job demand. In this case, Mr. DeGrasse had issues with stooping, bending. He was only able to bend at the occasional level based on our time test. So that's up to 33% of the workday. But based on the PDA, his job demand requires him to lift 66% of the workday. So there's a deficit there. He declined the kneeling and crouching tests because of pain. So we were unable to determine that job demand. And there were some issues with handling with his right hand. So on the right side, the job demand is constant, and he was only able to perform at the frequent level. So there was a deficiency there. So here's sort of a holistic look at his performance and matching it to his defined job demands. So if you really want to get into the nuts, to the numbers of things, the FAE reports generate a chart like this. So again, you have the activities listed, and you have some numbers. So this column here, CV, is the coefficient of variation. So as I mentioned earlier, any variance under 10% between the three trials is considered standard, is considered pass. Anything over 10% is considered invalid. So you can see here the bolded areas where there was greater than 10% variation. So basically, these performances were considered I don't want to use the word fail, but it was not a passable performance. Here is the industrial standard. So basically, this is the performance you would expect from an individual with similar age, gender, that is not injured. So basically, they've taken people through these tests, thousands of people through these tests, and they've determined what expected industrial standards of performance are. So 100 would be that this person meets the industrial standard of that movement. So walking, so 100% would be industrial standard. Mr. DeGrasse performed at 90%, which is pretty good. I mean, we don't expect everybody to perform 100% of the industrial standard. In some cases, he did over, he went over 100%, but in other cases, he did below the industrial standard here, and then there was a little bit here below. So, we also look at, how they performed matched to individuals without injuries, similar characteristics, right? And then here you look at the performances within the occasional, frequent, and constant ability. So anything in here is he performed within the constant level, anything that comes into here frequent, and then the rest occasional. So as a general rule, if he passes 80%, more than 80% of the coefficient of variation tests, then it's a valid assessment. So a passing mark is 80 on an FAE. So anything under 80 is considered invalid performance. Now, having said that, people that perform within 75 to 80% is still considered a fair performance. People obviously who have 30%, for 30 to say 60%, there's definite issue there with validity, as this individual passed the majority of the coefficient of variation numbers. However, we're also taking consideration, exaggerated body efforts, consistency between formal testing and observation. So somebody who may have, say, gotten a 75%, but you can tell they really tried and they had really good effort. At that point, we say, okay, although they scored a 75 based on their observations, it's likely that they were performing near their competitive level. This is an example of all the tests. So these are the percents, the variations. So again, all the positions of the gripping, we have them do it 3 times. So we look at their variation and their scores. So again, anything over, the cutoff is either no reliable, there's marginal, like if they're on the cusp, but it's still counted as an invalid. But the summary lists all this. I'm just showing an example of what you might see in one of the reports. So what does an FAE address and what does it not address? An FAE does not address questions regarding diagnosis. We are not there to diagnose the condition. We are there to test their abilities within their diagnosis. We determine if a patient substantially satisfies the essential physical demands to perform their work, or their activities of daily living. And we also make recommendations regarding modified or gradual return to work or physical restrictions related to work. And this is a nice tool for that, because as you saw in the previous slides, we see his performance, it may be frequent, but the demand may be constant. So we might make a recommendation saying, well, for bending, for stooping, limit his stooping to frequent or occasional, because he is unable to do the frequent, whatever the job demand is. So it's very good at precisely defining what their abilities are, because you can take 33% of the workday and say, okay, this person can only bend for 2.5 hours of the workday. So it's a very good tool to be able to extrapolate what their demands are, because the chart before will say, 38% of the workday, 42% of the workday. So what you do is you take 42% multiplied by 8 hours a day, and then you can make the determination, well, this activity can be done within this amount of time within the workday. So when is an FAE indicated? So here there's a lot of FAEs done within the realm of motor vehicle accidents. So the term is income replacement determinations. So to determine if this person can do their job demands or cannot, and if they cannot, whether they should still receive income replacement. Or due to the severity of their injuries, there's clarification needed on whether they can safely return to work. And oftentimes, people are 2 years after their accident or their injury, and there's likely no hope that they're going to return to work. So oftentimes FAs are used to determine, well, let's look at retraining this worker and see what they could do. But what are the parameters of their ability? So then a vocational assessor can then say, okay, these are jobs that can match this person's current physical abilities, match with their cognitive abilities and their education and work experience. So it's a very good tool and assisting workers be retrained and find something that's suitable to them based on their injuries. We also look at, determining housekeeping, home maintenance assistance. Some insurance companies provide that if they can perform their normal aspects of their ADLs. And again, like I mentioned earlier, it determines whether there's a disability, and a disability also from a legal, medical legal perspective in court, arbitration, legal proceedings. When is an FAE not indicated? When the accident condition is unstable. So if they just had a car accident and they're a cast, obviously they should not be doing FAE. Trust me, we get people coming in 2 weeks after surgery and they've been sent for an FAE and we have to send them home. If there's an unstable medical condition, if the individual just had a heart attack, then probably not the best time to do an FAE. Or a stroke, we want to make sure they have a stable condition. If a 95-year-old elderly gentleman comes in for an FAE, you might want to think whether it's safe for that individual to do an FAE. If they have active cancer, if there's a condition that's unstable at the moment, then again, if they're undergoing chemotherapy treatments, you don't want to put this person through more strenuous activity. And also pregnancy. I mean, you don't want somebody that's 8 months pregnant coming in. I generally, personally, do not do FAEs on pregnant women, just because I don't want to harm, because it's a physical test. There's a lot of low-level activities, a lot of lifting. So I recommend that that the FAE gets rescheduled after they're stable after their birth, postpartum. Other things you need to take in consideration, if it's a relatively minor injury, if the job demand is sedentary, yeah, we look at sitting tolerances and some dexterity tests. But again, sometimes an FAE may not be applicable. If the injuries are very severe and the job is physically restraining, if somebody has bilateral rotator cuff tears and they just had surgery and they're required to lift over 100 pounds, is that, you can conclude without an FAE, do you really think they'll be able to go back to that job without re-injury? So we have to take all that into consideration when we're looking at conducting FAEs. In most cases, with a good understanding, so this is again more geared to adjusters or case managers who are looking at referring someone to an FAE. Looking at the whole case as a whole, the injuries, the job demands, you can have a good understanding of whether an FAE is applicable. COVID-19, threw a bit of a wrench into things. This is something I have in my report. So obviously, when you're conducting these, if anybody out there is conducting these, we have to do COVID screenings, making sure it's a lot of contact. We can't do these assessments virtually. So, we have to make sure that we do all the COVID-19 protocols. Hopefully things are getting better, and I can remove this page from my report. So what to look for in a good FAE report. So you're going to see a lot of paper coming through across your desk that claim to be FAE reports. So now you need to know what to look for. You need to look for, are the key load and frequency tests administered? Some reports may not have the coefficient variation, all that fancy stuff, but at the very minimum, you need to look at whether these lifting was tested, and whether it was tested once, whether it was repeated, and whether it was tested at various heights. If you're looking for a really good report, you want to look for coefficients of variation, objective measures of validity. You'd like to look at conclusions that are supplemented with informal observations. If tests were attempted before terminated, if someone comes in and says, well, I'm not going to do any of this test because I'm scared it's going to aggravate my symptoms. Well, fine, I understand that. We take that into consideration, but oftentimes people will try the test and then stop saying, okay, yeah, I think this is going to hurt me. I'd rather stop. So when somebody outright declines all the tests without attempting them, then, you can assume that they're not they just don't want to do the test, and there's a low effort in trying to attempt them. Looking at, sitting in formal walking observations, why were tests not performed? We ask that question, we make a lot of notes. So, pain is a valid reason for why the tests aren't performed. So we need to, what type of pain are they having? Are they just scared they're going to have pain, or they know every time they do this test, they have pain? An objective report should not contain language such as pain focus. We're not there to say that people are, quote unquote, faking or pain focus. We're there to try to encourage them to do the best they can. And you don't want to come across that, you're biased, you have a preconceived, notion about this person. The good thing about FAEs is, the software, you don't really know what the performance is until you run the software at the end. So it's difficult for you to have a preconceived, notion of what's going to happen, because you're not calculating coefficient of variations as you're doing the test. So you really run the software at the end and then see whether there was an 80% pass rate. People in Canada see these WSIB FAF forms, which is sort of like a one-pager tick sheet of what the person can do. Usually it's filled out by a physician or, a rehab professional. I would look at these very carefully, because these are often, a bedside assessment. Patient will come in and say, well, I don't think I can lift over 20 pounds. So then the physician writes, okay, limited lifting 20 pounds. So a lot of these are not really supported by physical testing. It'd be great. So oftentimes at my clinic, physician will say, okay, no, give it to your physiotherapist. Physiotherapist will fill that out. And then, I may not do a full FAE, but I'll take them through some tests, some lifting tests, some, frequency tests. And then, I'm able to give some sort of prediction of what their abilities are. But obviously a full FAE will give you the best indication of what their abilities are. Some common misconceptions about FAEs, patients often think that it's better to decline an FAE test versus completing them, because, if they complete all the tests, they'll be forced to go back to work. And, what I say to my patients who are referred to going elsewhere for FAEs, I say, the best thing you could do is just try your best, because it'll always look better if you try a test. And even though you cannot do it, discontinue the test versus, outright saying, I'm not going to perform any of the tests, because, we're here to look for your abilities, your performance, and your effort. So it's always better to do the best you can during the test. And no matter how it goes, just try to put in as much effort as you can within your pain tolerance. I mentioned earlier, is an FAE with an invalid effort still useful? Yes, because although it might not give you a lot of valid information about what their physical abilities are, it still gives you some indications of their performance. And then oftentimes this is, consistent with, a medical evaluator. So oftentimes an FAE also occurs with a medical evaluation. So these two are so the medical examiner looks at the FAE, and there's a lot of consistency across both. So, effort is something that they look at, because if they weren't consistent in the FAE, oftentimes they're not consistent in the medical assessment as well. And then cognitive FAEs, are some questions earlier. So, there are now cognitive FAEs that we do that look at more of the cognitive demands of a job, whereas an FAE is purely physical. So this is in the context of head injuries, concussions, brain injuries. So, it's a whole set of tests. They're different than what we're doing. And we're looking at more, memory, delayed recall, fluency. So we're looking at a lot of the aspects, non-physical aspects of the job, and measure those similarly to the way we measure the physical tests in an FAE. And that's it. Any questions?
We have a few questions here. So what about the literature of healthcare workers increasing or contributing to fear avoidance behavior?
So yeah, oftentimes healthcare workers will say, we'll try to coach the patient and say, just don't do anything. And, we try to educate as many people as we can that actually has the opposite effect, because by going and saying, my doctor told me I can't do anything, we have to take that in consideration if there's a legitimate medical reason why they cannot do it. Like if they're post-operatively and then there's limitations in certain movements, obviously we're not going to do that. But sort of a blanket statement saying, my doctor told me not to do any physical activities, obviously that causes some issue, but we would try to, get them to do as much as we can. But that definitely is a factor. Yes.
Great. And what happens in the interim if the FAE is deferred to a time when the person is more stable? Would they still be covered financially, or would there still be a push to get them back to work even without one? And if that is the case, how can we help a person in this situation? And this is from the standpoint of a union rep supporting a person who is hurt at work.
Yeah, the issue with FAEs is oftentimes people are sent to us when they're better, a lot better. It would be nice to get them in early just so we can determine what their limitations are closer to the injury date. So, it's limited to it's a snapshot in time. So it's how the person performs today, not how he was after the injury. So I understand the question because we get that a lot. In order supporting a worker, he might be better now, but before he wasn't performing well, and the benefits probably were more applicable earlier than they were at the time of the FAE. But that's the limitation we have. At the time, it's only measures their FAEs at the time that they come in. In some cases, the benefit is paid until the FAE results come back. And if the FAE results determine that they cannot do the job, then obviously the benefit is payable retroactively, I would assume.
Okay, perfect. Thank you, Dennis.